Hello, everybody. Welcome, welcome, welcome. I'm your host, Dr. IIan Shapiro. I'm the Medical Director of Health Education and Wellness, and today I'm going to be talking about a lot of the opportunities that we have as medical advocates, and most importantly, how do you actually find your voice on all the crazy noise that we have around us. I'm a physician, a father, and a human for you. I'm very thankful for the California Area Health Educational Center because they actually are giving us the opportunity to have this amazing conversation. Then I'm just going to quickly say hello to you. I will be co-hosting absolutely everything that you're going to be seeing. Um, I do have an interesting accent, and I hope that you enjoy it. I'm going to make my sure that I'm going to give you a lot of homework, not a lot of headaches, but most importantly, opportunities for all of us to have conversations right now, and most importantly, for the future for all of us. Then I hope that you enjoy. One of the things that we're going to be talking about today is that I do not have any conflicts of interest. I work for a very qualified health center. I have been doing media, and most importantly, I have been reporting to my wife. She's my CEO. She knows all my financial disclosures, and she doesn't have any conflicts of interest either. This is me, born and raised in Mexico City. I'm here doing pediatrics in the US, doing a lot of public health, and most importantly, education on how can we connect with our communities, and most importantly, how can we do a lot of things for the future. Today, um, we have a lot of things in front of us. We do not know where we are. And sadly, we have all this stuff regarding COVID-19, and most importantly, there has been a lot of highlights regarding social determinants of health, and a lot of the things that we have as a community is that we rarely actually find the opportunity to continue creating conversations. Then we feel frustrated, we feel sad, we have a lot of things in front of us that, it doesn't work out for us. We know that it's not the best option for our community, or simply we know that it's morally wrong. Then it's important to find what actually makes you think and feel in order to proclaim and actually continue helping your community. And that's why it's so important to make sure that we go back and understand, what's your voice? What's the why are you actually want to raise stuff or information for the community? We have a couple of objectives for today. One of them is understanding how to advocate for a problem or concern in the community. Sometimes us as healthcare providers, we're on the front lines and we're seeing what's happening, as social workers, as promotores or promotoras, as, pharmacists, anything. We are seeing absolutely everything, what's actually happening in our community, and we sometimes know how to make it better. That's why it's important to make sure that we start planning, and we need to use common resources that we already have in our communities to make a difference. And that's kind of the important things that we have over there. And of course, the third objective that we have is understanding how a team will work. How can we create that map of understanding on who is actually the key players that we need to involve, um, in order to achieve maximum impact on our philosophy and our advocacy efforts that we have. And of course, like, we need to make sure that we understand that there's nothing common on the things that we're doing. Right now the fourth number is that, right now everything is non-linear. Sometimes a tweet can go viral, or maybe something in TV may not go as well planned as we think. Then it's important to actually leverage all the things that you have in front of you to make sure that you are helping your community in advocating with the correct things that we have in front of us. And the first question is, why advocacy? Why do we actually want to start like giving headaches to other people or creating a lot of things that we have in front of us? And part of this conversation is, do we actually have something there to share? Do we have something to achieve? Do we have something that we actually have an issue with, that it's powerful enough that we need to echo it in other places, or simply it's something that it's local but it's still important? where will you put that problem in your brain and mind? We'll be asking a lot of rhetorical questions, and it's kind of to get in a mood of, hmm, how am I actually going to be finding that solution? Or most importantly, what problem am I going to try to solve? Then part of this is it goes further on. Like you all have the power to make a huge difference in your community. It doesn't matter where you are, what you are doing. If you're actually seeing a problem there and you're seeing that there's something that can be changed, that's where we need to start putting the power. That's where actually we need to figure out the energy, and most importantly the streamline of absolutely everything that you're doing to make sure that at the moment that you're pushing it out there, it gets heard and it's powerful. And most importantly, it creates a lot of value for you and your entire community. As part of this, we're going to be changing right now for the next part of um, I'm going to start giving you a couple of examples. On your far left, you see a map. It's here in Los Angeles where I practice and I do my crazy day-to-day things. And we had a plan, a plant, and this was a company that was actually creating batteries, and it's called the Exide facility. And they had a horrible problem with the batteries, and they used lead. And actually, they polluted a lot of neighborhoods around the plant, and the air, the kids and everybody ended up having lead poisoning and high levels of lead. And as you know, lead actually can start like being attached to your brain and having big issues on the way that you think. You have problems with your IQ. You could actually have anemia. You can have a lot of bad things there. Then that's one of the problems that we were having here. Then a lot of people started advocating for that one. Another example that we have here, it's actually the what actually happened in Flint, and I didn't do this on purpose, but in Flint, they actually had a lot of issues with water, and especially with lead. Then the water was actually already leaded, and again the same problem. Problems with the brain, anemia, and of course, who will actually get worse outcomes with this? It's kids and vulnerable populations that we have in front of us, and that actually creates a lot of problems for absolutely everybody that we have there. And I'm moving it a little bit more to the right. One of the topics that I enjoy talking about right now, because it's something that we can actually change, and it's reflecting a lot of the problems that our society and healthcare systems have. It's talking about mortality rates in Hispanos and other populations regarding COVID here in California. And you see here that the numbers of Latinos and African Americans are actually, having the huge problems with death are not equally distributed, meaning that, in a lot of places, there's not, blacks and Latinos are not, the high moment of the population, not at all, but they're actually the ones that are getting the full blown problems from complications, actually incidents, anything that it's bad regarding COVID. Underserved communities are actually are actually receiving that blunt power of it. And here you will see another slide that actually that way we can actually zoom in a little bit more. You see the distribution between the numbers. From 0 to 24, a big chunk are Latinos and African Americans, and you can see how it gets diluted, and it gets to a point that after like 70 years, you will see that it starts shifting, and that shift is because there's not a lot of Latinos or African Americans actually surviving those ages as much as Asians and Caucasians. And we have a lot of things to learn, and you can start simmering the difference on equality and equity, and most importantly, how our society is actually distributing a lot of things. Um, I'm going to share with you one of the things that I have seen in the past months, and it's actually hurting my heart a lot. You have seen, how a lot of the problems that we're having as a society. are being reflected. And one of the things that we see here is one very famous New York Times front page that had 100,000 names from at that moment. And right now, as we speak, we're more than 250,000 deaths. But at that moment was like something that we never thought that we were going to be having conversation about, and we were having it. And the other thing is the disruption. You can see that amazing lady over there, that little kid. How come she's young. She doesn't have an idea of actually what's coming or what's happening, but her entire life, her entire infancy is actually being defined right now for COVID-19. Then we're losing a lot of people. Plus, we are not creating an emphasis of growth for the kids that we have right now. And it's, of course, we want to make sure they're safe and everything, but you start feeling that problem and fabric in our communities. Um, and of course, we start having a lot of questions. I pose these three questions for you. Why is the Hispanic community having these challenges? Why is COVID behaving this way? Is there a conspiracy behind it? Because a lot of people go like, okay, wait. You're telling me that this is actually the percentage of Hispanos here, and this is actually the percentage of people that are getting sick, are actually having problems, are actually going to the hospital, ended up in ICU and dying from it. And why the other population are not having it? Is there something specifically targeting the Hispano communities? And then your advocacy head starts to be pulled in, and you start thinking, okay, wait, what? There's a lot of information here. What do I need to do with this? How can I pull off my information and do something with this? That this is actually hurting my community. And that's why I put this example, because this is actually something that I started, being involved early February 2020, where a lot of the information and things that were happening to our community started to like uplift a lot of the problems that we were having as a community. And I said, I need to help on that part. I need to make sure that as much as I can create a shield for us and for our community, I'll be there completely to make a difference for all of us. And I'm going to go a little bit further with the information that I'm sharing with you. Um, of course, we have the definition of conspiracy, and you go like, well, a lot of the things that we're hearing and seeing and feeling, it's weird. It's not the most common thing, but what do we need to do? And of course, we have the conspiracy theory, right? And it says here, believe that someone convert but influential organization is responsible for a circumstance or event. That means that these buyers had some secret that was attacking the Hispano communities. Was it the virus or was it other stuff that we had before? But why we actually are having that problem? Why are the Hispano communities are being targeted with this? Then that's when you, only you, can actually start thinking of what's your feeling, why you actually want to do this, why is this something important for me. And on reality, when I started actually asking me that question regarding what's happening with COVID-19 in my community, they were like, wait, is it like genetically modified, or is there something else that we can actually learn today and make sure that we pass it along for the future in order to make sure that our communities and future kids and generations and other underserved communities, because we saw the numbers for the African American community, they're not far away. Then there's a lot of things that we can actually learn and improve for other communities. Then why? Then that's when the fun starts. We need to find your voice in all this process. We need to find why you want to do this and how are you going to do this. Then, after all the crazy stuff that I told you for a couple of minutes, I'm going to invite you to this amazing trip with me. We're going to follow a couple of examples, a couple of ideas, and we're going to start digging from information to actually piling up how or which tools we have in ourselves, in our community, or which ones we actually need to bring in order to find your voice with a problem that you want to solve. Then for me, and I'm going to go ahead and continue with the example regarding COVID-19, because it's something that there will be a lot of scholarly activities around this, more academic part of it, and it's still something relevant for all of our communities to learn, because we have it here and we have a lot of information to share regarding that. Then, finding your voice. Let's start having fun with this one. As we know, we need to understand what's the problem. And for me, I started, looking at the numbers. And you go globally, you have, at the moment that I saw this, it was almost 45. Right now, today is 46. And you see a lot of cases going up in a very high rate. And it's actually from Johns Hopkins. If there's any type of image that you don't like or you love, just feel free to go to that website. They have amazing things. Then I started like cutting stuff and making sure that every dot represented a community, a case, or a cluster. Then you can see here, at least right now, the U.S. is leading the cases, and it's real. We're testing more people, and we are making more available testing for everybody. But that doesn't say why we still have such a high indices and stuff like that. If you go to like other countries, for example, other places in the world like Taiwan, you see that they have no cases in a big chunk of time, or New Zealand. But you see here, there's a huge competition between the U.S., India, Brazil, Russia, France, Spain, Argentina, Colombia, and United Kingdom and Mexico over there, that they're being affected in a bigger time, in a bigger space. And I'm cutting it and going home. A lot of the times with advocacy, we all want to save the world. We all want to make a difference with everything, but we need to be very peculiar where we want to achieve our goals at the beginning. And the best way to start is actually getting closer to home. And right now, I'm giving you here the numbers from the US again. And when you start seeing how the case rate and daily cases are going up on the world, it's impressive. And you can see actually the curve that everybody's talking about the waves, and I'm sure that you will probably say the same thing, that we never went back down, and everybody's talking about the third wave. In reality, it's probably like the third peak, because we never went back to baseline. And here we see, the disparities in cases that we're having around the country at this moment. And you can see the central part of the U.S. actually being more affected at this moment than other places in the country. And when you start cutting it, and because a lot of the time when you go in front of a lot of the amazing public health officials, they will want to have data. And you know that in our community, they go like, well, okay, well, we close it, we open, and you can see here, this is, you have the new confirmed cases, and you will see that, the orange, green, and purple dots, and they mean that we actually did a public health intervention. You can see how this intervention made a difference, but all of this were not actually reflective of what was happening with the Hispano population, or didn't reflected why, in the entire U.S. we still have more cases that we wish to have, and most importantly, what can we do with it? And this is when I started getting that, and after that, we talked about the US part, we talked about the world part, but now here in my home in California, you can actually go and start like having amazing numbers regarding the data that we have. It's very sad to see Latinos and African Americans having a huge impact with this disproportionately for the amount of people that they are actually being presented as a group. You can see that the Hispano community, the Latino community, it's almost 61% of the cases. That's bad, and that's only for almost. And if you compare to the entire population, it's almost 40% of it. Then you can see that there you have a disparity. And the same thing with, you can see actually the same thing with African Americans and Asians, that the amount of cases they're having compared to the amount of cases that proceed to death and everything. There's a disparity there, and that's where I go like, oh, I will challenge everything. And is it a conspiracy or not? We're seeing more cases. They're affecting us more often than other communities. Where we are with that, and that is, my friends, the COVID story. That's where all of us as a community need to start gathering information. Why? Because it's more than a conspiracy. There's something that we can actually do. That's why, where you find a problem, you actually start like thinking, well, what's the local aspect of it? How is actually dividing everything? Who are the players? And right now, I chose the Hispano community. I chose COVID-19, and it started like melting, because it hits me hard home, because that's something that we can actually do, and create a better world for absolutely everybody in front of us. Then with the COVID story, in underserved communities here in the US, brings a lot of underserved um, uh, realities, a lot of social determinants of health realities, and a lot of the pain that we have had for many, many, many years. And most importantly, sadly, the opportunity to grow and create better things for our community without taking care of everything. Then what's actually happening with the COVID-19 and our communities? We know a couple of things. We know that the Hispano community, a big chunk of the community is going out there. They're actually essential workers. Then they're more exposed. They're working in places that sometimes they don't receive or get protection, like PPE, and they come back, after public transportation are being exposed, and they bring, of course, everything. And the same thing is happening with kids. There's a majority, a trend higher with kids than other populations, that are actually getting COVID. If you put everything together there, plus you add something that, we're talking about conspiracy, right? Well, it's actually not. It's decades of problems of social determinants of health. That's where we are. Social determinants of health. If you don't have enough, schools, you don't have enough hospitals or doctors around your community, if you don't have a lot of things around you, there's a lot of things that you're going to be losing. And if you create that toxic stress, toxic pressure on the system, at the end of the day, that thing that you have over here with the COVID will end up having a lot of issues and problems with the community. Why? Because we know, me as a doctor, I take care of 15% of their entire health, life. With medication, surgeries, hospitals, everything. The other 85%, it's social determinants of health. That's things that, with advocacy, with the stuff that we're talking right now, that's the stuff that will make a difference. That's the stuff that, if we actually align our efforts, we align our future, we align our power, that's the things that will make a difference for our entire community. Then, right now, I'm going to go a little bit further, and let's explore a little bit more of that. Now that you know, and you're like, oh, I need to do something. And you can choose anything in your life. But right now, we're talking about COVID. I need to do something. You need to prepare. You need to be ready to feel the pain, get the sweat, and make sure that you're getting as much information as possible in order to get you there. That's the most important things that we have right now. And that's where we all need to be moving, and that's where we choose to push forward with everything that we have here. And of course, are you getting ready? On the left side, that's the way that it feels. That you're, yes, I know that I want to protect my community. Am I willing to climb that wall? Does it have enough safety, everything? Am I ready to move? And just imagine being there, the air, the magnitude of the rock. Of course, it's not. It feels heavy, but someone needs to do it. Someone needs to go to the other side to help. Someone needs to actually have that adventure. And the same thing as running a marathon. And you can see here on the right, You need to prepare yourself for a while until you get to the point that I'm ready. 20 miles, nothing for me, nothing for me. And that's actually what I'm going to try to achieve with you today. I want to actually get you rolling in your mindset, to get you pushing forward. That way you don't feel alone. You choose your problem and make sure that you understand the power cycles that we have to push you forward in order for you to find your voice. And that's my mission for the next couple of minutes. You will see right now that apart from preparing yourself with absolutely everything that you have in front of you, um, a lot of the times we revert, we stop talking. Um, why? Because it's easier to just say, what, it's hard. I don't have time. I'm different. They will never listen to me. Um, I don't like to talk with people. I don't like to talk in front of people. I'm horrible in TV. I'm horrible writing. I have issues. We all have issues. But the thing here is that we all have a special magical power. And we'll talk about that part. We all have something inside of us that can actually be used in order to advocate for our community and our problems that we're having in front of us. Then don't despair at all. You need to make sure that you need to recognize that we have learning curves. That's perfectly fine. And we have already magical powers, as I call them, that we can. They are really available at any time. That we actually calling in, and most importantly, we can actually push it out and make a difference for our community. Then come with me and let's walk this conversation together. One of the things that we're going to be teaching you is the 5 steps that for your pathway. One of them is going to be why you enter this. What's your passion? What tools do you have? Who are the parties and who are actually the key players there? And how are we going to be evaluating this in order to push it forward and making sure that you're actually um, going and achieving your dreams and going and achieving absolutely everything that you have in front of you in order to actually achieve something amazing for your community. Then let's start with that one. Um, let's start with why. Why do we actually want to know everything? Why do we want to push forward with this? And the truth. The why is, for me, it was actually finding the voice for our community. I was finding a community and making sure that are represented and getting, fair and square tools in order to defend them against COVID-19. And that's my why. Because I feel that I'm part of it, and it burns me when I see families being destroyed. I hate when like families that were coming here with in my clinic, that were the grandmother was coming with me, la abuelita, and a lot of the people were coming with me, and suddenly the abuelita is not coming back. And I asked, what happened with the abuelita? She had a little bit of diabetes. And they tell me, what, Dr. Shapiro, she died from COVID-19. Then that's why I'm actually doing that. And it's your mission to figure out what's your why. Finding your in a lot of us are very good at amplifying other whys, but you need to have something that you believe on, that it's inside of you, that it's burning. It could be, you know, anything. It could be prostate cancer, breast cancer. It could be gender, just gender social justice, voting, anything that is in front of you that you feel passionate, go and achieve it and grab it and push it forward. That's where you need your entire power for it. Um, and of course, what's your passion? Because why is kind of understanding where you are with everything. And passion is that extra energy that you have there. Why is kind of when you put on Google Maps or anything, or even ways, you put your place, that's your why, that I want to go there. But the passion is actually the energy, the car, everything that will push you there and will get you there. And that's where it's one of the most important things is, um a lot of the times, you have the why. We want to save lives, and the other thing is you with the passion part. That's the one that will save you a lot of the problem time. Why? Because it's not good, advocating and doing and finding your voice is very exciting, but you'll have like very steep problems, and after that you will go up and down, and you will continue climbing, and it depends on you that you continue having that energy to achieve all the things that you have in front of you, and that's extremely important for all the activities that you're having, for all the advocate stuff that you're creating. And we can continue that part of the conversation. And of course, what are the tools that you have? And here you have in this slide a couple of things. You have, the option to write a lot of things, TV, radio, social media, logistics on the ground. And this, don't get me wrong, this is actually a non, some of the examples that I have for you. These tools amplify your message. They amplify what you're feeling. And of course, you need to be concrete on the way that you are sharing with absolutely everybody else. Um, what's your message? And the important thing is we all know what's our actually default system of communicating. For me, for example, it was very it was more on the TV side, more on the social media side, because for errors of destiny, I ended up uh, creating or writing a lot of scripts in TV. And after that, one day the reporter got sick, and I ended up doing that part, and I loved it. That was actually my first pandemic in 2009 for the H1N1. But there's people actually, for example, I'm horrible writing. It takes me a lot of energy to write. Then there's people that go like, well, no, doc, I actually can write all day and all night long, and I have no issues whatsoever to do that part, and that's perfectly fine. Then you need to find how are you going to be choosing from these options that we have, from the writing part, from the TV, radio, social media, or logistics on the ground, meaning, going boots on, are you going to the Congress and actually going and see your representatives and talking to them? And that stuff depends completely on you and the way that you will be achieving things. Then make sure that at the moment that you have absolutely everything in front of you, you choose one of this, and don't be afraid. That's the most important thing. Do not be afraid. There's people that love, they hate seeing themselves, but they have amazing voice, then they can do radio, and that's perfectly fine. Or right now, with the nonlinear power that we have, social media, it's another amazing option that we have in front of us. And as a community, you can choose where you go and where you want to push that energy. Then don't think that it's only TV or only radio and social media. And there's people that actually do not like all of those. They just want to be outside, making sure that they bring grassroots level activities to places, and that's perfectly fine. Find what's your passion and make sure that you surround yourself with other people that can complement you. For example, for COVID-19, one of the things that we did here in in the LA County and actually Orange County, we created a lot of amazing partnership with the public health department, with a couple of universities to bring technology to share screenings and other stuff with the community. That way, they would know before going to the doctor if there's a high or low or no propensity to having COVID at all. Then and that actually there were cheap tools, and that we were advocating for that because we knew that there were not enough doctors for all the people that were going to be getting sick. We knew there were not enough doctors that were bilingual or resources to actually translate for them. Then that was kind of where we were at that moment, and that was not far away or far along. And of course, you have here, we already talked about the why, your passions, and the tools that you have. But it's extremely important that we see this slide, all of us. Part of it is who is on your map. To make sure that you create a map of who are the owners of the conversation. And of course, right now, I put community on the center because my community for COVID-19 is kind of the highlight of everything that I'm doing and that I'm creating. Then that's the most important thing that I have. After that, you can see, like other people around it, and putting on the little guys actually hugging each other on the left. um you, they are hugging, and that actually represents a lot of the, like the private parties. And of course the middle part is the families that I want to help. And on the right side, when you see two hands, for me that represents, the government, the public aspect of it. And how can we actually um, congratulate or bring them, all of them, together for the same conversation. And it's hard. Whoa, 100% it's hard. I'm not I would love to tell you that, you call them, and everybody's waiting for your call in order to advocate for your issue. No, 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 no. That's why you need to figure out which partners to get. And sometimes, and I strongly recommend you to do it early on your thought process, because that way you will actually understand who are the key players, and most importantly, who are the ones that are the key, the doors. You need to find who is actually the gatekeepers for absolutely everything that you're doing, because sometimes, if you're broken ego over there or here or there, it's going to be harder to go across. It's possible, but it's going to be harder to cross that door. And it's extremely important that you bring that conversation with you and create that map that I'm suggesting for all of you. um, the next thing that we need to be figuring out is, the learning cycle. um, you need to learn who are they, where they are, and the key players. And then putting here, you need to convert yourself at little, like spies. You're going to, for advocacy, you need to convert yourself with spies. And this is what I mean with that. You need to figure out who are your key stakeholders. And when you know that, you need to go and Google them or link them, or make sure that you're actually going and trying to grab their attention. A lot of the times, in the old days, it was, it's still very important, the networking part of it. But with now, it's who do you know in LinkedIn, who do you know in Google, who where you put all that stuff. And the more information that you get to actually do something with it, the better will be for absolutely everything. And the technology is there, and the forums are there, and you just need to make sure that you're pushing the correct buttons and the people. And most of the time, if you want to advocate for certain things, you can send a message and see what happens. And maybe not the biggest chief or the president of the world, but maybe someone else. Maybe the second one or the third one, or maybe you can see that there's a relationship with a best friend that you have. Something. Then just make sure that you're advocating and putting that tools to work for you. One of the other things that we have here for the community is the learning cycle that we strongly recommend with this. Then, part of the thing that we have here is the cycle, and you can see here the learning part of it. Then you need to learn, and we already did that part. Who are the stakeholders? What are you doing? How you want to implement it, and everything. And of course, there's no way that we will move forward if we don't try it. Then make sure that you're trying absolutely everything that you have in front of you. Then and try it. And most importantly, if you don't evaluate and you don't talk about it, and you don't know if you're doing a good thing with your advocacy project, because you maybe feel that you're saving 100,000 billion lives, and the world has only 8 point something, then clearly we are missing the point. Then after that, you need to create a solution. You already evaluated, create a solution, and most importantly, plan again. And this will give you all the tools that you need on a rapid cycle of improvement to understand where you are with your advocacy power and where you want to go and move forward. And of course, that your passion is equally important, your brain and your heart, because both of them are the ones that actually push you forward. And understanding where you are, what you are, what's your passion, who do you need to talk with, what are the tools that you have in your disposal. All of them will actually push you forward. And of course, just an amazing reminder of where you are with everything, and the passion that you bring to us, the pathway of this. Remember your why, remember your passion, your tools, your parties, and most importantly, the cycles of improvement. Then whenever you have an issue with advocacy, I'm boiling down to like simple steps that it's kind of a cookbook. I'm giving you a recipe to put any problem on the front line of advocacy to create like the 101 basic framework to start actually doing something for your idea, passion, or problem that you want to solve. And moving forward with absolutely everything is what's next. We have been talking with with each other for the past couple of minutes, and but what's next? Like, yes, you started this movement. There's a wave coming. There's a lot of things, but what's next? The most important thing that I want you to do after this conversation, the conversation is making sure that you reach out and you act, and act. And what do I mean with this? I mean that you actually go out there and start talking with a lot of people. And it doesn't matter if you're a student or a doctor or a nurse or a public health official. It doesn't make a difference. If you have a problem that you want to solve, a passionate thing that you want to advocate for, you need to go out there and ask. After that, you can choose your tools. If you're going to do a big march or you want to actually enact policy, it will depend on you and the tools that you have in your hands. But you make sure that you continue moving. If you froze in time, there's no movement. You're going to get stuck absolutely there, and that's not worth it at all, at all, at all. And then you start having problems. Then make sure that you reach out, and act with absolutely everything that you have in front of you. Act, and act. And don't despair. And of course, we need you. We need you more than ever. With absolutely everything that is happening in the world, with everything that's happening here in the United States, in our continent, in Latin America and North America, we're having a lot of issues right now that can be fixed, and most importantly, that needs to have a voice, and that's why, you need to figure out what's your path, and most importantly, and I put this question: at the end of your life, how you want to be remembered? Do you want to be remembered as someone that just you were present but you didn't do anything, or someone that actually tried to make a difference for your community, for your fellow humans, for your fellow world of humanity in these times of despair? And remember, the most important thing that I have in front of you is that after all this pathway and uh, bridges that we created, you have found your voice, uh, and that's the most important thing. You are there, you're ready, you have the tools. Then you need to remember to act, and act to push forward absolutely everything that you have in front of you, and making sure that you're happy, that you're enjoying the company of absolutely everybody that you have around you, and most importantly, that you find your why, your passion, your tools, your parties, and you're ready to understand that cycle of fast improvement of what's happening and moving forward. And again, thank you so much for this opportunity. I'm here on behalf of California AHEC. If you have any questions, make sure that you have all my data and information over there. Let's continue the conversation. And I hope that you learned something, that you actually understood something, and most importantly, that you have something in front of you that you can keep, share, and most importantly, act upon. Then this is again Dr. IIan Shapiro. Have fun, enjoy everything, and continue advocating for the things that actually are important for you. Have fun, change the world. Thank you.